This is the case of detransposition of great arteries. In this image, you can see the structure. This is right ventricle, this is left ventricle. Normal orientation. This is pulmonary artery, this is aorta. So from left ventricle pulmonary artery, from right ventricle aorta. So this is retransformed because right atrium right ventricle and left atrium left ventricle is normally connected. Though you cannot see that thing in this image, but that is the scenario. So right atrium to right ventricle and left atrium to left ventricle, and then left ventricle to pulmonary artery and right ventricle to aorta. So this is the case of detransposition of great arteries. Now the next image, you can see this image, how it is connected. So initial part of pulmonary artery like this flow, like this flow. So both are parallel. This is initial part, this is aorta, this is pulmonary artery. This is left ventricle, this is right ventricle. Both are parallel. At the same time, the direction of pulmonary artery is downward. Posteriorly you can see, because this is most anterior part. So this is most posterior part. So upper part of the image skin is anterior and lower part of the image skin is posterior. So you can see the pulmonary artery that is coming out of left ventricle is going posteriorly, indicating this is not the aorta, this is pulmonary artery. So whenever you find a structure that is coming out of left ventricle and going downwards, that means image downwards, but in real it is going posteriorly, because upper part is anterior, lower part is posterior. So going posteriorly, indicating pulmonary artery is coming from left ventricle. At the same time, what you will find? You will find another structure that is also great artery, and both are parallel. So it indicating transposition of great arteries. Since the right atrium, right ventricle and left atrium, left ventricle, normal concordance, that is concordance, that is why we call it detransposition of great arteries. In moving image you can see this, like moving image like this. So here you can see this is parasternal long axis view, and you see the more part of pulmonary arteries coming from left ventricle and less part is coming out of right ventricle. Ultimately pulmonary artery is overriding interventricular septum and there is subpulmonary BSD. But this is subcostal view. In this view what you see, you will find that pulmonary artery is mainly coming out of right ventricle, but which ventricle and which artery, how much is coming from which ventricle must be decided by parasternal long axis view. So even you have any confusion, then you have to confirm it by parasternal long axis view, not by the subcostal view. Sorry, it has changed. Image you see, in this image, this is aorta. Let me change the color. This is aorta, this is pulmonary artery, this is left atrium, this is left ventricle, and this is right ventricle. So you can see this is BSD. Here the BSD has left right flow. The initial part of the direction is like this and like this, both are parallel. So initial part of great artery should be compared, and that is parallel, that means transposition of great arteries. In moving image you can see how the image is moving. So aorta is almost everything is getting from right ventricle, and pulmonary artery is getting both from right and left ventricle. Same image, parasternal long axis view. This is this is pulmonary artery, this is aorta. aorta. This is left atrium, left ventricle, right ventricle. Moving image you can easily find out. This is subcostal view, and what you see in this image, this is right ventricle, this is aorta, and this is pulmonary artery. So pulmonary artery getting turbulent flow, so there is some sort of flow obstruction, either flow obstruction or getting more amount of blood, that is why it is getting more velocity. So little bit of obstruction is likely because getting more blood both from right and left ventricle, so obstructed flow. So what you are getting in this image, pulmonary artery is also getting more blood from right ventricle, but truth is not there, because the direction of the flow in green color, this is direction of flow from left ventricle to pulmonary artery. So direction is not aligned properly for the color Doppler, so color flow representation in this image is not that much good, because it is not vertical. So if color flow becomes better when it is vertically oriented to the probe, not horizontally oriented. Here the image, in this image, the flow from left ventricle is horizontally to the pulmonary artery. That is why flow is not that much prominent in this image, though all blood from left ventricle is going into pulmonary artery. Same thing, one thing important, that you will find both great artery parallel, especially in the beginning. You can say the same thing again. This is pulmonary artery, this is aorta. This is aorta, this is pulmonary artery. I have already told you how much of pulmonary artery is coming from left ventricle and how much from right ventricle should be decided by parasternal long axis view. This is subcostal view. This is not parasternal long axis view. So this part is liver. So this is subcostal view. Thank you.